quite the crowd. Thanks for being here. I'm sorry if I'm the reason you're staying late or have to be here early, but I'm the Vericel rep. Probably more commonly known as the Maci rep. So Vericel is the company I work for. It's a biotech out of Boston. It's been around for quite some time. If anyone remembers a company called Genzyme, we still do, and they used to sell skin for burn patients, and I sell what's called, technically speaking, autologous chondrocyte implantation. So we regrow cartilage, and we've been doing that since, there's a Swedish, just to give you a quick background, a Swedish physician by the name of Lars Peterson back in the 80s did some research in New York and found out if you actually have chondrocytes taken out of that white, shiny cartilage that you find in your knees, grow them, expand them, clone them, put them back in, you can regrow articular cartilage. And then he started doing that in Sweden back in the late 80s. He came to the US in the mid 90s, and we've been going strong ever since. Genzyme was the company that first developed it here in the US. They were a big biotech that a French pharma company bought years ago. And then our lab broke off. We were the first FDA approved, licensed tissue engineering lab in the country, and I think we're still one of only a few that are allowed to do that. So in this procedure, we're taking a healthy sample of their cartilage in their knee, and we're cloning those cells, expanding them out by tens of millions for an actual implant back to the patient to regrow their articular cartilage. So the physician here that is using it is Dr. Taylor. Any orthopedic physician can use it, but it's indicated, get to the really important stuff here actually, it's indicated for articular cartilage injuries in the knee that have not responded to like a prior procedure. So that could just be a simple cleanup, a debridement, any other failed procedure. So it takes 2 steps, and the first step is why I'm here today. Honestly, this is really the easy part, if you ask me, and I'll get into the kit here in just a moment, but if it's just the worst day ever here, and you've got so much going on, if you only remember one thing, is just let Dr. Taylor get the cartilage in the container that's inside here. You literally could, at 10 o'clock at night, get to doing the paperwork, but then it needs to get out the next day. We prefer the same day. So this transport kit goes off to our lab in Boston, and the techs there will chop up the cartilage that comes to us, and then they'll start pulling out the cells. So that's why we're doing this, is so that we can have something for the patient when they come back 6 months, or even out to 5 years is how long we keep the cells for a secondary procedure, which is the fun part, it's the implant. So if we ever get to that point, which hopefully we do for Dr. Taylor, a little membrane, which I don't have with me today, of course, but it'll come back. It's cut to size to fit the injury in the knee, and then they glue it in, and within a matter of about, actually a few hours, it starts to occur. The cells migrate down to the bone, and then they regrow cartilage outward. So, any questions about the overview, the 30,000 foot view, and then I'll get into this?
Nope.
Good? Okay. All right, so this is the biopsy transport kit. I always tell folks, you're welcome to call me at any point in time. However, the phone number on this is your best resource, if you ask me. Because once the biopsy is put in here, when you call you have to call them, because they have to activate a courier to come grab this from you. And they're here within, they say 2 hours, but actually it's sooner than that, because we're not out in the boonies of Nebraska, we're in Omaha. They will walk you through everything. So you don't have to use this for a year, and all of a sudden, boom, it happens to you one day and you can't reach me, just call them. They'll walk you through every bit of it. And then they'll activate the courier to come grab it. So we'll kind of go over what's inside the kit. All right, so there's some foam packaging. I'll try to do my best to show you what we have here. You're gonna keep everything with the box. These cold packs in here, the only reason we keep them the way they are, we don't even put them in the fridge any longer, we used to. They're here for cushioning for the transport medium. So if they're cold, not a big deal. If they're not cold, not a big deal. Just keep them in there. The other couple items in here, this is actually bovine serum, so we just call it cow juice. It's more or less like amniotic fluid from the segregated herd that we have, because we use a lot of bovine serums in our cultures and our mediums. So this actually does stay in the fridge. It's not the end of the world if it isn't, but you know, in the heat of the Nebraska summers, we prefer not to let it sit on the loading dock for 3 days before you decide to use it. So try to get it at least here at room temperature, preferably in the fridge. It does have an expiration date on it. It's not super long. Usually it's about 9 to 10 months. And that's all I'll say about the medium, just for the time being. Stop me any moment if you have questions. The medium also has a little biohazard bag that once the cartilage is in there, you'll slip into and you'll seal it up. That's the other item that's inside there. We even went as far as putting little pieces of tape to tape up the box so you don't have to search for one. This is for the patient or patient's family, which talks about the fact that they took a biopsy today. But the other service that we have, which won't apply so much to you guys and ladies, is we have something called My Cartilage Care. So when the patient's family says, yeah, my child needs to have an implant, I have a case manager that works just with me, and she gets approval, insurance approval for all the cases that are going to happen. So they walk them through everything from start to finish. So that might be helpful for the patient's family to look at. And like I said, if all you remember today is get the cartilage in the container, this is what I'm talking about. So just get it down inside here. He knows what size of sample to give us, but just so you are aware too, it's about the size of 2 Tic Tacs. And if I remember right, Sean maybe can help me with this. You guys have ring curettes here that he uses? Okay, so there's an instrument already available for him. And I think we have at least one of these in stock still. Maybe 2. Yep. So let's go over some of the other items, and this is kind of the nitty-gritty work. A lot of these you won't necessarily need, but there are stickers like any other medical product. Instructions, which you probably won't spend a whole lot of time with, but they're here. They're in the envelope. Reorder form, of course. There's 3 things I think are most important. So when it goes to FedEx, they do want a biological substance sticker. And I think if I didn't already do it for your kit, I would just grab it anyway and slap it on the box. So it goes on the back side of the box here, that sticker on there. Okay. Any questions about that part? Pretty self-explanatory. There is a label already in the kit, so just put that on top of your boxes. Well, they'll ask you for the tracking number, of course, when you call us. Okay, so down to the administrative part that you'll want to spend some time with during or after the case. There is a sticker up here. So this thing's in triplicate. We call this our transmittal notice. So it gives us information about what the doctor saw that day, who the patient is, kind of what expectations are going forward. Please always fill out this sticker up here. Some people put a patient sticker from the chart onto this vial. We prefer to have this. So it just shows us the date and time. Actually, it's just the date of the biopsy and the patient's name. So in case it gets to the lab and something gets separated, we can always track it back to that biopsy medium. And then it's pretty self-explanatory for the rest of it on top. It's talking about the patient's date of birth, the gender, the time of the biopsy, right or left knee. It does ask for the expiration. You put that here. And then about the middle section are questions you'll ask Dr. Taylor. So what else did you do to the patient? Was it a loose body removal because it was a fragment that was thrown off? Was it a debridement, an ACL repair at the same time? It's all right there. Just check the one that he did. And he knows this part too. The next box talks about the injury itself. So medial or lateral condyle, trochlea patella, the size of it. So you just ask him, what size of injury did you have there? And it's in centimeters. He might tell you mils, who knows? Just convert it to centimeters, move the decimal. And then down here, for example, if he's going to go back and do a procedure, it's good for us to know, is he going to do an osteotomy on that patient? Is he going to do an ACL repair on that patient? So you can ask him these questions too. The things in the middle, you can ask him those questions. And the bottom part is very self-explanatory. The name of the facility, a person here who's your contact or our contact, and then his autograph down here, and the date that it occurred. It comes in triplicate, so there is a copy for the patient, for the physician, and also for the patient's chart. We do actually like to have this HIPAA privacy notice. It's not the end of the world if we don't get it with the kit when it comes to us. But if you have time with the patient's family before, after the case, this helps us communicate with them. We can still get it after the fact, but this kind of helps speed things up. A lot of times I probably only get this about 50% of the time, because for a lot of these cases it can just pop up. That's why it's good to have this kit here, so if he gets surprised, because MRIs really don't show the extent of the injury for cartilage. So if you don't get it, like I said, not the end of the world. Save a copy for yourself. I'm just going to kind of put the things in the box that so you have a visual. So cartilage is in here, the stickers around it. This goes inside the envelope. Imagine that I sealed it up. We're going to place that down inside there. The top form, and we'd like to have a face sheet also. You can print a face sheet. Put the face sheet, and if we're lucky enough, we get the HIPAA form, put those items in the box. And then the rest of it, we kind of already went over, pretty self-explanatory. You've got the FedEx label that is slapped on the top of the box. You'll put the bio sticker on the box as well, and then just call the number on the front of the box. Okay, kind of went over a lot. Any questions?
Questions, anybody?
Worries, concerns? Yeah, I'm very glad you asked. Thanks for reminding me of that.
Can you repeat that question?
So, the question was, how are you, correct me if I'm wrong here, how are you transferring it? What's the most efficient way to transfer it into the container? Yeah, so what I always tell folks to do, take the top, if you have that red Sharps container with like the magnetic side, the darker side of it, break that half off. Tell the doc to put it in that Sharps container. That way it's easier for you to see it. Instead of it being in a lap and it gets caught and it's hard to see because they're both white, put it in that container, and then it is sterile inside this. But a lot of people like to hand off a pickup or something when they're done with it, because what we're going to ask you to do is grab the cartilage and get your pickups, like your Adsons, all the way down inside, rattle it around in the fluid, and it'll pull that cartilage off the teeth of the Adson. And then just hand off the instrument when you're finished with it. So you get a gold star. Thanks for asking that question. Anyway, so did that help?
Yeah.
All right. Okay.
Any other questions?
Actually, for Sean, will we know when he wants to do this, or is it a random thing he gets in there and says?
50-50.
Okay.
50-50. So our kit is located in fridge number 1, right outside of the art room. So I'll put that in one of our lead updates at the end of the week this week. And then just a couple other comments on there. Filling out the sticker that goes on the label. The sticker does not always allow it to bleed through to the triplicate form, so you may just pay attention to having to fill that out. Dr. Kaler has also been really good about filling out those sections where he was telling us to ask him the questions on size, procedure, stuff like that. I've lately just been leaving that on the desk in front of there for him and saying, hey, this is your section, and then he goes and fills it out because he knows all that information readily, and we know how much they like to be asked a million questions while they're in the middle of the procedure, so he's been taking care of that. And then with the HIPAA form, like he said that it's not the end of the world if you don't get it. If it's one of those things where it pops up, like in the middle of the case, you're going to use it, I've just been asking him to take that sheet with him when he goes to talk to family and such, and he's been, the last couple times, he's been decent about taking that with him and explaining, hey, I used this, they can fill out the form or not, and then he'll bring it back to the front desk.
Because if you're having that little circular